Hello, I'm Matthew Houde, Vice President of Government Relations at Dartmouth Health. Government Relations is so pleased to roll out the 2022 We Care, We Vote initiative. We Care, We Vote is a nonpartisan voter education initiative designed to encourage participation in the 2022 midterms. We do this by providing information on registering to vote and voting in New Hampshire and Vermont. You can find these resources on the Dartmouth Health website under Health Policy. As a 501c3 organization, Dartmouth Health does not engage in election intervention activities, meaning we don't tell people whom to vote for, but we do invite all candidates for discussions so that we can learn where they stand on issues and have an opportunity to ask questions. I want to thank you for your engagement and remind you to vote on November 8th. I'm pleased to welcome viewers to the latest session of We Care, We Vote Health Policy Grand Rounds. And with me today is Gerald Malloy, candidate for U.S. Senate from Vermont. Mr. Malloy served in the U.S. Army for 22 plus years and has worked in private sector business since 2011. Welcome, Major Malloy.
Thank you, Matthew. Great to be here. Appreciate it.
And I also wanted to say thank you for your service, by the way.
Thank you.
Easy one to start.
Sure.
You want to tell viewers about yourself?
Sure.
And what has you running for U.S. Senate?
Sure. Married, lived down in Windsor County, and I watched my opinion. Last year, I didn't like the direction of the country, and Mr. Senator Leahy made his announcement. That's when I first thought about running, and glad I did. Took kind of stock of my career, 42 years of service. I think I'm fully qualified to be a United States Senator, and started campaigning in January. And I right away started seeing from the Vermonters were resonated with the things that I was offering and want change. So it's been an absolutely great experience and very encouraged. And I was able to win the primary back in August and campaigning up against my opponent now, and it's been going fantastic.
So I looked at your website, and on the website, it references the following with respect to healthcare. And I'm just going to quote it so I don't get it wrong, which talks about reducing healthcare costs, not universal healthcare per se, but initiatives to reduce price gouging and improve Medicare, Medicaid, and the Veterans Administration operations.
Sure.
What are your proposals to reduce healthcare?
Sure. Well, I am looking at reducing the costs, and overall, my view is to have less government involvement in private industry. A few things specifically I'm interested in looking in increasing the option for right to try, increasing the ability to gain insurance across state lines, increasing competition within the healthcare industry, and also, one thing I was just kind of became aware of. I know that, for instance, people that English is a second language have issues in terms of understanding their bill or their insurance. So maybe having some initiatives there, so people that don't speak English get their bill and insurance in whatever their native language is. I think trying to maybe increase or decrease the layers that I think might be adding costs. And I've got some ideas in terms of the drug costs, healthcare, the drug piece of that. I think maybe even starting to look at the patents that, as we talked about out in the hallway, maybe looking at government patent policies to reduce the time frame for patents that might be able to lower those drug costs over time.
And that would be by allowing drugs to be produced in a generic form as opposed to the name brand form.
Correct.
I just want to clarify for viewers what the reference to the patents is.
Yep.
Okay. So many of Dartmouth Health's patients rely on Medicare for their coverage as a source of their health insurance. And so I think that the 2022 Medicare Board of Trustees annual report predicts that Medicare will be financially insolvent much sooner than it has in the past. And it talks about unable to fulfill its commitments starting in 2028. And CMS proposes annual Medicare payment rates that do not keep pace with the medical inflation. And so you referenced Medicare, and if elected to Congress, if elected to the Senate, what would you do to ensure that Medicare is solvent and available for seniors who need it?
One of the things that I've talked about quite a bit on the campaign trail, I think there's been massive overspending, and you've seen our debt go up well over $31 trillion right now, and trillions of dollars of overspending in the last couple of years. That is having an impact on our ability to pay for entitlements such as Social Security, Medicare, Medicaid. It's getting to the point right now where I've seen some articles about a do loop where we're just going to have to keep borrowing money just to pay the interest on that debt. So what I look to do if I become a United States Senator is to get back to fiscal responsibility and spending within a budget and not continue to add to that debt, because that debt, you're exactly right, Social Security, Medicare, Medicaid, it's going to start impacting the United States government ability to support those programs.
I heard that you are supportive of Medicare
Yes.
and Medicaid and Social Security.
Yes.
And I'm curious if there are areas of spending that you'd care to share that you think that there's overspending today that might address some of that.
In terms of when I say overspending, for instance, the president deciding unilaterally, in my opinion, avoiding the separation of powers in the Constitution to spend $500 billion so that the taxpayers can pay someone else's student loan. That's an example. Another, I would call it reckless, massive reckless and misguided overspending. So some of that, for instance, would be $80 billion for 87,000 new IRS agents. I think there's, it kind of gets back to my view that right now, Vermonters, and I've been campaigning since January. I've met thousands and thousands of Vermonters, and the things I'm hearing about, the crime crisis, the drug crisis, and the economic crisis. Those are the three main issues. But there's another issue, folks. My opponent talks about threat to democracy. I think there is a threat to democracy in that, there's a what's going on in the current administration is being hijacked, so to speak, by the far left that's making decisions that are not representative of all Vermonters. And for instance, spending that kind of money, $80 billion on 87,000 IRS agents, that's not what all Vermonters or all Americans want. I want to look at what we do spend money on to and get within fiscal, responsibility so that we can continue to pay entitlements like Social Security and Medicare and Medicaid.
Before moving off that topic,
Sure.
My assumption, and I should never assume something, is that you receive care at the VA. Is that accurate or not?
I go through TRICARE through the military. So I retired 22, went to West Point, and then 22 years active duty, and I do have TRICARE. Yep. And my wife does a great job working through that. I have actually talked about looking in terms of the VA to try to, I think the VA does a great job, but I think sometimes there may be some barriers and challenges for folks to get services there. So I do want to increase that, improve on that some.
I'm going to take the thread of one of the things that you said. I'm going to go a little out of order on my questions.
Oh, sure.
The region, mm-hmm. Vermont, New Hampshire, mm-hmm. The country, but this area in particular was dealing with a significant opioid crisis, sure. Pre-COVID pandemic. Mm-hmm. It didn't go away, mm-hmm. And so people are still we're kind of coming back to the surface a little mm-hmm. bit. The problems that people are having.
It's right on the surface. I've met folks all across the state, many thousands, and we are at crisis level here in Vermont. You might not think it, but we are. I was up to Johnson, it's the Jenna's Promise, and you walk in there and you see the wall of folks that have overdosed. I guess you didn't ask your question, but a couple of things I can talk to that about is I have a business background. I want to try to grow well-paying jobs here in Vermont. I don't think that's been happening. I think I can seek to bring industry here to Vermont or even government relocation here to Vermont, grow well-paying jobs. I think that's part of the equation. Folks have those good jobs, not to turn isolated rural, not to turn to drugs. I think the other point, key aspect to attacking the war on drugs is I actually consider it a chemical warfare with China and Mexico pumping. I've talked about this. 10,000 pounds of fentanyl seized last year in the United States. A synthetic opioid. And so I call that chemical warfare. That's enough to kill 2 billion people. It's coming through our very unsecure southern border. So I look to take some actions to try to secure the border, And the third piece of that is to actually restore the image of our law enforcement community so that our law enforcement community gets back to full strength and starts, it doesn't have the feeling, you see the progressive prosecutor movement, you see what's going on in Burlington now, it's got a crime problem. Absolutely. So that, get rid of the progressive prosecutor movement so that folks that commit a crime actually go to jail and stay in jail. And that, I think, will be a deterrent to help reduce the amount of drugs that are flooding our country right now.
You spoke to the front end
Okay.
of that,
Sure.
and I'm going to, since we're at Dartmouth Health,
Yeah.
I'm going to ask a question about treatment for those suffering from substance use disorder. I'd be curious to know your thoughts about having adequate provider resources for substance use disorder treatment, often co-occurring with mental health challenges. And so I'm curious if you have a position or thoughts about that topic.
Well, if you're asking about safe injection sites, I'm not. I've got to do a little bit more research on that, but my initial impression, I'm not in favor of those. But of course, I do want hospitals to be able to treat people.
Dartmouth Health and member hospitals like Mount Scottney and providers have been on the front line of the COVID pandemic.
And thank you for that.
Thank you. And it's impacted the financial health of hospitals. It's impacted communities, I think, in many ways. And Congress has addressed the shortfall in revenue that occurred when hospitals stopped doing elective surgeries and procedures so that they could make room for what they assumed was going to be a big influx of COVID patients. And that's much appreciated by the federal government to do that. Hospitals are still suffering, and I don't know that there's going to be federal dollars as readily available going forward as there had been. And I'm curious what your thoughts are on how the federal government might continue to support hospitals as they continue to navigate the recovery through COVID.
That's a good question, and I would have to get on the ground and see, what the budget is, and start making those tough decisions and negotiations and prioritizations. I actually did talk with. We talked about the bi-state healthcare, and in their meeting with them, they had given me a lot of information and said that they were looking to double their budget from last year to next year, or this year to next year. I told him, I said, I think we need to head into some times where we really take a close look. And I told him, I say, I don't see that happening to double your budget. I will take a look at prioritize what's important for Vermonters and Americans to move forward in the future. But as I mentioned, the overspending has led us to this period of inflation. 13% food inflation, 16%, electricity inflation. I've heard some very high numbers. I think we're at a very vulnerable position in terms of our current energy, oil and gas levels right now. I think any kind of spike in that could cause, for instance, home heating oil to spike up significantly. I think that actually is probably going to happen. We're at 1984 levels in the Strategic Petroleum Reserve, but it's going to require taking a hard look. I would have to look and see about that kind of funding. I do understand what you're saying, but I'd have to look at it.
Okay, fair enough. How about one of the other areas that was particularly challenging was getting what we call PPE, personal protective equipment. And I'm curious if you could speak to your views on how the government could secure an adequate supply chain for healthcare providers. I mean, that's my focus. Obviously, there are other areas where the supply chain was impacted.
I look for the government to actually help secure that supply chain. I was going to show you that after the military, I worked 5 years with government agencies, and a couple of those years I did pandemic influenza planning and response operations.
Okay. Yep.
Yeah, I've done about 20 presidential disaster declarations, but I actually worked on. I don't know if you can see that. Yeah, that's the assessment of states' operating plans to combat pandemic influenza, report to the Homeland Security Council. I wrote quite a bit of that back in 2009. It was for Secretary Chertoff and Secretary Leavitt. So I'm aware of the need to have the supplies at hand, because not when it's too late afterwards. And I think we've seen that through COVID in the last 2.5 years.
One of the other things that healthcare providers and hospitals found particularly helpful during COVID was what waivers that CMS put into place to provide flexibilities for providing care. What are examples? The examples that I would give surround use of telehealth, the ability to provide care to someone in their home via telehealth. When the public health emergency ends, those waivers will go away unless Congress codifies them in statute. And so I'd be curious if you have an opinion or a thought about those waivers and flexibilities going forward.
Well, again, I would have to look at those. That seems reasonable to me. And I think I will even go into education. I think we're going to have changes in how education is conducted here in this country. I can tell you my daughter has taken some online classes that she's thrilled with, and that might be a little shift in how we educate our college age folks. So I would absolutely be amenable to looking at that. Of course, I'm not looking at it here, but the good ideas that benefit Vermonters and are cost saving, I have no issue with that at all.
One of the things that we found during the pandemic and right at the beginning was the necessity to provide care in a different way through telehealth. And so you could be in your home and you could have a checkup with your provider here. And one of the things that was necessary to make that happen, of course, was the technology. Not all areas of New Hampshire and Vermont have adequate broadband coverage for the video component of it, but many have audio and so can connect on the phone with their provider. But it was flexibilities that were necessary with licensure because you needed to be licensed in the state that you're providing care. Typically, let's say, for argument's sake, you'd come into Dartmouth Health, Mary Hitchcock Memorial Hospital. Your doc just needed to be licensed in New Hampshire because you were in that facility. But if they're providing care to you and you're sitting in your living room in Vermont, we needed to be able to have reciprocity with licensure. And I will say, Vermont really did a tremendous job of making that happen in short order.
I would be in favor of looking into that at a national level. I mentioned, being able to buy insurance across state lines. It's 2022. I think it's time we moved in that direction.
One of the challenges that we continue to face, and it is actually one of the factors I think increasing healthcare costs, is the expenses associated with healthcare workworkforce. And other industries have this challenge too, with a shortage of workforce. And so you may have seen spending additional dollars on what they call travelers, people who are coming in to do short duty stints from out of the region. Curious what your thoughts are on what the federal government can do, if anything, to address some of those challenges particular to workforce challenges.
It is challenging, and I see it in the business world too. Of people, labor rates, even I provide services to government agencies, mostly in D.C. in the last 11 years. Rates have gone up, and folks are coming and going much quicker, and turnover is much higher. And folks are turning down, still turning down higher rates. So it's a challenging time. I think it will settle over hopefully next coming months. Although I do think the economy is not in good shape right now in terms of being in a recession, and I don't like seeing all the tamping down of. I think the response has been very poor. You've probably seen the mortgage rates have more than doubled, and again, another high inflation rate just yesterday that is going to result in another probably 75 basis point increase. So mortgage rates are going to keep going up. So we're in for some tough times. I think we've been brought to this position again through the massive overspending.
I'm going to bring it back to the last challenge of providing healthcare in a rural region, right? So New Hampshire, Maine, and Vermont are among the oldest populations. And I think that exacerbates the workforce challenges that exist. And it makes delivering care in a rural area more challenging because transportation issues, et cetera. And I'm curious if you have any particular thoughts about either delivering care or delivering services in a rural part of the country. I mean, you live in Vermont. probably encounter some of those challenges. We love Vermont, New Hampshire, and Maine for lots of reasons, but the nature of the state's rurality poses some challenges.
I did work with I think I mentioned the bi-state healthcare centers. I think that there might be part of that safety net for rural, maybe lower income folks. I do look to continue to support that at the federal level. Not exactly sure, what else the federal government's going to do about that. We did talk about consolidation. I think that's pros and cons there, but as we just talked about, maybe that is, happening, and we even talked about a local hospital having some financial challenges, and whether or not it consolidates based on those or not. That's economic decisions that organizations have to make. So that's ongoing. Obviously, I want continue to have or improve rural services, and you're right. Vermont is very rural, so. I'm not sure the exact answer, how to really best address that, but I will look into it.
Okay. So just to bring viewers up to speed, if you don't mind.
No.
The part of the prior conversation about healthcare costs had to do with the implications of consolidation. And there certainly are arguments on both sides of the consolidation discussion. And I don't think Mr. Malloy took a position on that. It was a conversation piece.
Yeah.
And there was recognition that there are challenges for hospitals, smaller hospitals, particularly in rural regions, in terms of capacity and access and reimbursement for the services that they provide. So I think that captures kind of our conversation on that topic, an acknowledgement of some of the challenges, but not necessarily a solution at this juncture.
It's a challenge, and it's something I will look into and will look to address as a U.S. Senator. Can I say one thing?
Of course.
We did talk about the broadband, and you're right. I can tell you, having campaigned all over the state, I've been to all 14 counties quite a bit, and the internet reception is sometimes not there at all. I mean, you can go 45 minutes without any. So I do look to improve that across Vermont.
Second to last question. So I want to talk about diversity, equity, and inclusion, which is an area that Dartmouth Health has been significantly engaged in. Most recently brought in a vice president of diversity, equity, and inclusion, not just as a workforce recruitment, but as the kind of the right thing to do in terms of recognition of the diversity of our workforce. And I'm just curious to your thoughts about what the U.S. Senate or a senator can do in that space to advance those efforts.
Well, industry organizations can, as you've explained, do that. One of my platform issues is to get back to abiding by the Constitution, and from that, before that, I look at the Declaration of Independence, and it talks about pursuit of happiness. So I support that for all people, and I applaud your effort there.
Okay. So we've covered a lot of ground, a lot on healthcare, but I want to make sure that you have an opportunity to address issues that I haven't asked or that we haven't addressed yet. So this is your moment to share anything that you'd like to that I haven't touched on.
Well, I appreciate you having me on. I guess a little bit about me. I have an MBA from Temple and a graduate certificate from Georgetown, and I'm a veteran. And my platform talks about getting back to abiding by the Constitution and promoting economic prosperity, ensuring defense, security, and order. That's been resonating with Vermonters across the state. I've met many, many, many thousands of Vermonters. The main issues that we've talked about that are, they're concerned with are crime and drugs and the economy, the inflation and the gas prices. So I have positions that will address those for Vermonters. I look to serve and represent Vermonters. I talked about that a little bit, represent all Vermonters. And I ask all Vermonters for their vote, and I will deliver a better future for Vermont.
Well, it's been a pleasure to have a conversation with you, Mr. Malloy. Thank you.
Yeah, thank you very much, Matthew.
And thank you for watching, and stay tuned for the next session of We Care, We Vote's Health Policy Grand Rounds.